Question 1. While receiving a flexible endoscope in the decontamination area, a technician determines it requires high-level disinfection based on a specific framework. Which classification system dictates this requirement? A. Ziehl-Neelsen. B. Medical device classification. C. Spalding. D. High-level disinfection. Correct answer C. Knowledge point explanation. Core rationale. The Spalding classification system is the foundational framework used in sterile processing to determine the required level of disinfection or sterilization based on the body part the device will contact. It categorizes items into critical, semi-critical, and non-critical. Trap analysis. Option A is incorrect because Ziehl-Neelsen is a stain used to identify acid-fast bacilli. It would be correct if the question asked for a microbiological staining method for tuberculosis. Option B is incorrect because medical device classification typically refers to FDA regulatory tiers. It would be correct if the technician was verifying the FDA pre-market approval class of a new implant. Option D is incorrect because high-level disinfection is a process or a result, not the classification system itself. It would be correct if the question asked specifically for the required processing level of a semi-critical item. Concept extension. Items entering sterile tissue or the vascular system are critical and must be sterile. Items touching mucous membranes are semi-critical and need high-level disinfection. Items touching intact skin are non-critical and need low-level disinfection. Question 2. While preparing a bone repair set at the assembly workstation, a technician handles a heavy surgical instrument featuring a beveled edge. An osteotome is specifically designed to A. Cut or shave bone. B. Retract heavy tissue. C. Clamp bleeding vessels. D. Hold bone fragments in place. Correct answer A. Knowledge point explanation. Core rationale. In medical terminology, osteo refers to bone and tome refers to a cutting instrument. Therefore, an osteotome is specifically designed for cutting or remodeling bone during orthopedic procedures. Trap analysis. Option B is incorrect because retractors are used to pull back tissue. It would be correct if the technician handled a Whitelawner or Richardson instrument. Option C is incorrect because hemostatic forceps are used to clamp blood vessels. It would be correct if the instrument was a Kelly or Crile forceps. Option D is incorrect because a bone-holding forceps is used to stabilize fractures. It would be correct if the technician handled a Lane or Kern forceps. Concept extension. Always protect the sharp edges of osteotomes during sterilization and transport using validated tip protectors to prevent damage to the instrument and the packaging. Question 3. After a total joint procedure, a technician is preparing to send borrowed orthopedic sets back to the outside manufacturer. When returning loaned items to the vendor, the technician must ensure that A. All items are completely assembled and sterile. B. Trays are returned immediately after point-of-use treatment. C. All items are completely cleaned and decontaminated. D. Trays are terminally sterilized and sealed in plastic. Correct answer C. Knowledge point explanation. Core rationale. According to OSHA regulations and safe transport guidelines, all medical devices must be thoroughly cleaned and decontaminated before leaving the facility to prevent the spread of pathogens to the public and vendor employees. Trap analysis. Option A is incorrect because assembly and sterilization are the responsibility of the receiving facility before surgery, not the returning facility post-surgery. It would be correct if the technician was preparing the tray for the operating room. Option B is incorrect because point-of-use treatment is only the first step and does not render the items safe for public transport. It would be correct if the items were simply moving from the operating room to the decontamination area. Option D is incorrect because terminal sterilization is not mandated for vendor return transport under OSHA guidelines. It would be correct if a specific local hospital policy explicitly demanded sterile transport for all outgoing biohazardous materials. Concept extension. Always maintain detailed records of loaned items, including the date of return and the person who performed the decontamination. Question 4. While evaluating various materials for steam sterilization in the prep and pack area, a technician removes an unsuitable wrap from the supply shelf. Which of the following is not an acceptable sterilization packaging material? A. Muslin. B. Paper cloth pouches. C. Canvas. D. Twill woven fabric. Correct answer C. Knowledge point explanation. Core rationale. Canvas is a tightly woven heavy material that does not allow for adequate steam penetration or air removal. Sterilization packaging must be porous enough to let the sterilant in but dense enough to provide a microbial barrier. Trap analysis. Option A is incorrect because muslin is a validated woven material. It would be a correct answer if the question asked for a traditional reusable fabric wrap. Option B is incorrect because paper cloth combinations are validated for specific sterilization methods. It would be correct if the question asked for a pouch material suitable for steam but not hydrogen peroxide. Option D is incorrect because twill is a type of acceptable woven fabric for wrapping. It would be correct if the question asked for a durable reusable wrap that requires laundering. Concept extension. All packaging materials must be cleared by the FDA and validated by the manufacturer for the specific sterilization method being used. Question 5. A technician is placing a small stainless steel needle holder into a pouch for sterilization. Peel pouches should be sized and applied properly to A. Allow for adequate air removal and sterilant penetration. B. Fit neatly inside standard storage bins. C. Prevent tip protectors from slipping off the instrument. D. Allow the instrument to move freely from end to end. Correct answer A. Knowledge point explanation. Core rationale. Proper sizing ensures that there is enough space for the air to be evacuated and for the steam or gas to circulate around the entire instrument. It also prevents the pouch from bursting during the pressure changes of the cycle. Trap analysis. Option B is incorrect because logistics do not dictate clinical sterilization efficacy. It would be correct if the question asked about the goals of organizing the sterile storage room. Option C is incorrect because tip protectors should be secured by proper application, not by the pouch walls. It would be correct if the question asked about the purpose of using the correct size of the silicone tip guard itself. Option D is incorrect because excessive movement can cause the instrument to puncture the pouch. It would be correct if the question asked what happens when a peel pouch is excessively oversized. Concept extension. When using peel pouches, leave at least 1 inch of space between the instrument and the edges of the pouch to allow for material contraction and expansion. Question 6. While checking the environment of the sterile storage area, a technician identifies a localized growth of organisms on a damp wall. Mold, mushrooms and yeast are categorized as A. Gram-negative bacteria. B. Fungi. C. Gram-positive bacteria. D. Prion. Correct answer B. Knowledge point explanation. Core rationale. Fungi are a group of eukaryotic organisms that include microorganisms such as yeasts and molds, as well as the more familiar mushrooms. They play a significant role in environmental contamination if humidity is not controlled. Trap analysis. Option A is incorrect because gram-negative organisms are bacteria that appear red or pink after staining. It would be correct if the technician was dealing with a Pseudomonas aeruginosa contamination. Option C is incorrect because gram-positive organisms are bacteria that retain a purple stain. It would be correct if the technician was identifying Staphylococcus aureus. Option D is incorrect because prion are abnormal infectious proteins. It would be correct if the question asked about the causative agent of Creutzfeldt-Jakob disease. Concept extension. In the SPD, maintaining a relative humidity of 30% to 60% in sterile storage is critical to prevent the growth of fungi like mold. Question 7. A technician is assembling a delicate micro-instrument set for a procedure that reconstructs the eardrum. This surgery is known as a A. Tympanoplasty. B. Stapedectomy. C. Cochlear implantation. D. Myringotomy. Correct answer A. Knowledge point explanation. Core rationale. Tympanoplasty is the surgical operation performed for the reconstruction of the eardrum and the small bones of the middle ear. The suffix plasty indicates surgical repair or reconstruction. Trap analysis. Option B is incorrect because a stapedectomy involves removing the stapes bone. It would be correct if the surgery was for treating hearing loss caused by otosclerosis. Option C is incorrect because a cochlear implantation involves placing an electronic device into the inner ear. It would be correct if the procedure aimed to bypass damaged portions of the ear to stimulate the auditory nerve directly. Option D is incorrect because a myringotomy is a surgical incision into the eardrum to drain fluid. It would be correct if the procedure involved placing pressure equalizing tubes in a pediatric patient. Concept extension. Instruments for tympanoplasty are extremely delicate and often require the use of an ultrasonic cleaner and specialized micro-instrument racks. Question 8. While inspecting a flexible bronchoscope after manual cleaning, a technician looks through the eyepiece and notices several sharp black dots. Dark areas on the viewing lens of a flexible endoscope indicate A. Residual bioburden or debris. B. Water droplets inside the channel. C. Burned out light-emitting diodes. D. Damaged glass light fibers. Correct answer D. Knowledge point explanation. Core rationale. Flexible endoscopes contain bundles of glass fibers that transmit light. When these fibers are broken due to improper handling or overbending, they can no longer transmit light, appearing as black dots in the field of view. Trap analysis. Option A is incorrect because residual debris usually causes a blurry or cloudy image. It would be correct if the technician saw a hazy smudge that disappeared after recleaning the lens. Option B is incorrect because water droplets cause a distorted or wavy image. It would be correct if the scope had a leak and fluid invaded the optical system. Option C is incorrect because flexible endoscopes traditionally use external light sources transmitted through fibers, not internal light-emitting diodes at the tip. It would be correct if the question referred to a specific modern digital endoscope with a defective tip chip. Concept extension. If more than 15% to 20% of the light fibers are damaged, the scope should be removed from service for repair to ensure adequate visualization during surgery. Question 9. A technician arrives for their shift and begins unloading soiled surgical instruments from a closed transport cart. The technician is working in which specific area of the sterile processing department? A. Preparation and packaging. B. Equipment storage. C. Decontamination. D. Terminal sterilization. Correct answer C. Knowledge point explanation. Core rationale. The decontamination area is the designated space within the sterile processing department specifically designed and equipped to receive, sort, and clean contaminated medical devices following strict infection control protocols. Trap analysis. Option A is incorrect because preparation and packaging is a clean area for assembly. It would be correct if the technician was inspecting clean instruments for functionality. Option B is incorrect because equipment storage houses clean patient care equipment. It would be correct if the technician was retrieving a clean infusion pump for a nursing floor. Option D is incorrect because terminal sterilization is where packaged clean items are sterilized. It would be correct if the technician was loading wrapped trays into a steam sterilizer autoclave. Concept extension. The decontamination area must maintain negative air pressure relative to surrounding areas to prevent the spread of airborne contaminants. Question 10. While processing respiratory therapy equipment, a technician loads a specialized machine that submerges the items to achieve high-level thermal disinfection. Pasteurizers disinfect using A. Heated water. B. Phenolic compounds. C. Glutaraldehyde solution. D. Peracetic acid. Correct answer A. Knowledge point explanation. Core rationale. Pasteurization is a thermal disinfection process that provides high-level disinfection by submersing items in hot water at 150 to 170 degrees Fahrenheit for a specific contact time, usually 30 minutes. Trap analysis. Option B is incorrect because phenols are low to intermediate level environmental disinfectants. It would be correct if the technician was mopping the floor of the decontamination area. Option C is incorrect because glutaraldehyde is a high-level chemical disinfectant used for manual soaking. It would be correct if the technician was using a toxic liquid requiring specific ventilation to soak an endoscope. Option D is incorrect because peracetic acid is a liquid chemical sterilant used in automated endoscope reprocessors. It would be correct if the question asked for the active chemical agent used in a rapid low-temperature sterilization system. Concept extension. Items must be completely submerged in the water bath of the pasteurizer to ensure all surfaces reach the required temperature for the full contact time. Question 11. While loading soiled surgical trays into an automated mechanical washer disinfector, a technician configures the cycle settings. Which of the following practices regarding mechanical washers is incorrect? A. Multi-level trays should be separated. B. Trays with solid lids should be opened. C. Complex instruments should be disassembled. D. All delicate and heavy items should be washed on the same cycle. Correct answer D. Knowledge point explanation. Core rationale. Different medical devices require different cleaning parameters regarding time, temperature, and impingement. Using a single cycle for all items can lead to inadequate cleaning of heavy orthopedic tools or cause severe damage to delicate micro-instruments. Trap analysis. Option A is incorrect because separating multi-level trays is a correct practice to ensure water impingement reaches all items. It would be the correct answer if the question asked what must be done to a layered orthopedic set before washing. Option B is incorrect because opening lids is required to allow cleaning solutions to enter the tray. It would be correct if the question asked how to process a closed container system in a washer. Option C is incorrect because disassembling instruments is a standard requirement to ensure the cleaning solution reaches all surfaces. It would be correct if the question asked for a fundamental rule of preparing a Fraser suction tube for mechanical washing. Concept extension. Always consult the manufacturer instructions for use to select the validated cycle for specific instruments, such as those requiring a gentle or delicate cycle. Question 12. While lifting a 30-pound orthopedic tray at the assembly station, a technician experiences back pain and realizes this ergonomic hazard violates federal worker protection standards. Which agency enforces these workplace safety rules even without a specific regulation? A. Occupational Safety and Health Administration. B. Environmental Protection Agency. C. Food and Drug Administration. D. Association of Perioperative Registered Nurses. Correct answer A. Knowledge point explanation. Core rationale. Under the General Duty Clause, the Occupational Safety and Health Administration has the authority to cite employers for recognized hazards in the workplace that are causing or are likely to cause death or serious physical harm, even in the absence of a specific standard. Trap analysis. Option B is incorrect because the Environmental Protection Agency regulates environmental disinfectants and hazardous waste emissions. It would be correct if the technician was checking the registration of a new floor disinfectant. Option C is incorrect because the Food and Drug Administration regulates the safety and efficacy of medical devices and sterilants. It would be correct if the question asked which agency clears a new biological indicator for market use. Option D is incorrect because the Association of Perioperative Registered Nurses provides professional guidelines and recommended practices for surgical settings, not federal workplace laws. It would be correct if the question asked for a professional organization that publishes guidelines for surgical attire. Concept extension. Sterile processing technicians should systematically report ergonomic hazards, such as heavy tray lifting or awkward reaching, to their supervisor to prevent musculoskeletal disorders. Question 13. While preparing a complex cardiovascular set, a technician applies a small barcode tracking identifier using pressure-sensitive adhesive to the shank of a hemostat. This specific instrument tracking method is known as A. Dot peen marking system. B. Dot marking tape system. C. Laser etching system. D. Chemical etching process. Correct answer B. Knowledge point explanation. Core rationale. The dot marking system involves applying small, color-coded or bar-coded dots to instruments using a specialized adhesive. This allows for individual instrument tracking without permanently altering the metal surface. Trap analysis. Option A is incorrect because a dot peen system uses a mechanical stylus to physically indent the metal surface with a barcode. It would be correct if the technician was using a machine to strike the metal permanently. Option C is incorrect because laser etching uses a focused light beam to permanently burn a mark into the instrument. It would be correct if the question asked for a permanent tracking method performed by the manufacturer that does not use adhesive. Option D is incorrect because chemical etching uses acid templates to permanently mark the device. It would be correct if the technician applied a chemical solution over a stencil to label a retractor. Concept extension. Ensure that any marking tape or dots are validated for the specific sterilization method to ensure they do not harbor bacteria or peel off during the high temperature cycle. Question 14. While retrieving a contaminated surgical tray from an isolation room, a technician notes the patient acquired a severe infection 72 hours after being admitted to the facility. An infection acquired while receiving treatment in a medical facility is formally called A. Surgical site infection. B. Multidrug resistant transmission. C. Community acquired infection. D. Healthcare associated infection. Correct answer D. Knowledge point explanation. Core rationale. A healthcare-associated infection is defined as an infection that a patient acquires while receiving treatment for other conditions within a healthcare setting, typically manifesting 48 to 72 hours after admission. Trap analysis. Option A is incorrect because a surgical site infection is specifically localized to the surgical incision, whereas the scenario describes a general facility-acquired infection. It would be correct if the patient specifically developed purulent drainage directly from an abdominal incision post-surgery. Option B is incorrect because not all facility-acquired infections involve drug-resistant organisms. It would be correct if the question specifically asked to classify an outbreak of methicillin-resistant Staphylococcus aureus. Option C is incorrect because a community-acquired infection is present or incubating at the time of hospital admission. It would be correct if the patient showed symptoms of the infection on day 1 of their hospital stay. Concept extension. Effective instrument cleaning and sterilization are primary defenses against healthcare-associated infections, maintaining strict environmental controls. Question 15. While donning personal protective equipment in the decontamination area to clean instruments exposed to a specific hemorrhagic virus, a technician reviews transmission routes. Which of the following viruses is transmitted via direct contact with blood rather than through the airborne route? A. Chickenpox virus. B. Ebola virus. C. Shingles virus. D. Measles virus. Correct answer B. Knowledge point explanation. Core rationale. Ebola virus is a bloodborne pathogen transmitted through direct contact with infected blood, secretions, organs, or other bodily fluids. It is not considered an airborne disease like the others listed. Trap analysis. Option A is incorrect because chickenpox is highly contagious and spreads via airborne transmission. It would be correct if the question asked for a common childhood viral infection requiring a negative pressure isolation room. Option C is incorrect because shingles, caused by the varicella-zoster virus, can be transmitted via airborne particles from blistering lesions. It would be correct if the question asked for a virus that causes painful rashes and requires airborne precautions in its disseminated form. Option D is incorrect because measles is one of the most contagious airborne viruses known. It would be correct if the technician was studying an airborne virus that requires an N95 respirator for all entering staff. Concept extension. In the sterile processing department, face shields and fluid-resistant gowns are specifically designed to protect technicians from bloodborne pathogens during the manual brushing of splashed instruments. Question 16. While assembling a heavy total hip arthroplasty tray, a technician identifies various implants used to rebuild the structural framework of a patient. Which body system provides this rigid internal shape and support? A. Muscular system. B. Nervous system. C. Skeletal system. D. Circulatory system. Correct answer C. Knowledge point explanation. Core rationale. The skeletal system is composed of bones and cartilage that form the internal framework of the body. Its primary functions are to provide a rigid structure for support, protect internal organs, and allow for movement by acting as levers for muscles. Trap analysis. Option A is incorrect because the muscular system provides the contracting force for movement, not the rigid structural framework. It would be correct if the question asked which system attaches to bones via tendons to create motion. Option B is incorrect because the nervous system transmits electrical signals to coordinate body actions. It would be correct if the technician was processing micro-instruments for a spinal cord repair surgery. Option D is incorrect because the circulatory system transports blood, oxygen, and nutrients throughout the body. It would be correct if the technician was preparing instruments for a coronary artery bypass graft. Concept extension. Sterile processing technicians handle many heavy instruments designed for the skeletal system, including orthopedic bone saws, drills, and various titanium implants like plates and screws. Question 17. While brushing the lumens of a flexible gastroscope in the decontamination sink, a technician determines it falls under the semi-critical category of the Spaulding classification system. This device must receive a minimum of which process prior to use? A. High-level disinfection. B. Intermediate-level disinfection. C. Low-level disinfection. D. Terminal sterilization. Correct answer A. Knowledge point explanation. Core rationale. Semi-critical items are those that come into contact with intact mucous membranes or non-intact skin. According to Spaulding, these items require a minimum of high-level disinfection to be safe for patient use. Trap analysis. Option B is incorrect because intermediate-level disinfection only kills mycobacteria and most viruses, which is insufficient for items touching mucous membranes. It would be correct if the technician was wiping down a patient thermometer or tourniquet. Option C is incorrect because low-level disinfection is for non-critical environmental surfaces that touch intact skin. It would be correct if the technician was disinfecting a blood pressure cuff. Option D is incorrect because while terminal sterilization is ideal, it is not the required minimum standard for a semi-critical flexible endoscope. It would be correct if the technician was processing a critical item like a surgical bone drill that enters sterile tissue. Concept extension. Common semi-critical items processed in the sterile processing department include flexible endoscopes, respiratory therapy equipment, and anesthesia mannequins. Question 18. After manually cleaning a laparoscopic grasper, a technician uses an electronic testing device to check the protective outer shaft coating for pinhole leaks. This electronic insulation testing must be performed. A. In the decontamination area before manual washing. B. In the clean assembly area prior to tray packaging. C. Inside the steam sterilizer chamber during the cycle. D. In the operating room immediately before the incision. Correct answer B. Knowledge point explanation. Core rationale. Insulation testing is a critical safety step to detect pinhole leaks in the protective coating that could cause stray electricity to burn the patient. This must be done in the clean assembly area when the instrument is clean, dry, and being manually inspected for function. Trap analysis. Option A is incorrect because testing in the decontamination area is dangerous due to wet conditions and potential shock hazards, and the bioburden could hide defects. It would be correct if the question asked where the initial leak testing of a flexible endoscope occurs. Option C is incorrect because insulation testing requires manual operation of a specialized device that cannot function inside an active high-temperature sterilizer. It would be correct if the question asked where a biological indicator vial is processed. Option D is incorrect because discovering a failed instrument in the operating room causes surgical delays and poses an immediate patient safety risk. It would be correct if the question asked where the final visual inspection by the surgical team takes place. Concept extension. Insulation failure is a major cause of unintentional tissue damage during laparoscopic surgery, therefore, absolute 100% inspection of these instruments is strictly mandatory. Question 19. While inspecting a cardiovascular tray in the clean assembly area, a technician uses a specific document to verify that exactly 6 mosquito forceps are included. This document utilized to detail the exact contents of a specific tray is called A. Manufacturer instructions for use. B. Biological indicator log. C. Tray count sheet. D. Sterilizer printout record. Correct answer C. Knowledge point explanation. Core rationale. A tray count sheet is a standardized list that identifies the specific names and quantities of instruments that belong in a particular tray or set. It serves as the primary reference for technicians during assembly to ensure accuracy and completeness. Trap analysis. Option A is incorrect because the manufacturer instructions for use detail how to clean and sterilize the device, not how many belong in a specific hospital tray. It would be correct if the technician needed to verify the correct steam exposure time for a complex power drill. Option B is incorrect because a biological indicator log tracks the results of sterilization efficacy tests. It would be correct if the technician was recording the results of a daily test pack incubation. Option D is incorrect because the sterilizer printout record verifies the physical parameters like time and temperature of a specific cycle. It would be correct if the technician was reviewing the documentation before releasing a cart of sterilized items. Concept extension. In modern sterile processing departments, electronic count sheets are often integrated into tracking systems, allowing technicians to scan each item individually as it is placed in the tray. Question 20. Before entering the decontamination area to manually scrub blood-soaked trocars, a technician dons specialized fluid-resistant garments. This mandated safety attire worn to minimize exposure to bloodborne pathogens is formally known as A. Personal protective equipment. B. Standard operating scrub attire. C. Sterile surgical gowns. D. Universal facility uniforms. Correct answer A. Knowledge point explanation. Core rationale. Personal protective equipment is the specialized clothing or equipment worn by an employee for protection against a hazard. In the decontamination area, this strongly mandated protection includes heavy gloves, fluid-resistant gowns, face shields, masks, and dedicated shoe covers. Trap analysis. Option B is incorrect because standard scrub attire is the base layer of clothing worn by all staff in restricted areas, which provides zero fluid resistance against pathogens. It would be correct if the question asked what attire is required before entering the clean assembly area. Option C is incorrect because sterile surgical gowns are worn by the surgical team in the operating room to maintain a sterile field, while decontamination technicians use non-sterile fluid-resistant gowns. It would be correct if the question asked what the surgeon wears during a sterile procedure. Option D is incorrect because universal facility uniforms is a made-up term that does not reflect federal regulatory language. It would be correct if the question asked about general dress codes for hospital cafeteria workers. Concept extension. Personal protective equipment should be donned in a specific logical order and must be fully removed before leaving the decontamination area to actively prevent dangerous cross-contamination. Question 21. While preparing a Fraser suction tube at the assembly workstation, a technician must actively dry the internal channel before packaging. To properly dry the internal lumens of cannulated instruments, the technician should A. Push air through with a standard fluid syringe. B. Insert a tightly fitted cotton swab. C. Blow out residual moisture using pressurized instrument air. D. Place the lumens on approved drying pegs. Correct answer C. Knowledge point explanation. Core rationale: lumens are hollow channels that can trap moisture, which interferes with sterilization and can lead to microbial growth. Instrument air is highly compressed, filtered, and dried air used to safely blow out any remaining water from these narrow channels. Trap analysis: option A is incorrect because a fluid syringe does not provide the continuous high pressure needed to fully dry a lumen. It would be correct if the technician was flushing detergent during manual cleaning. Option B is incorrect because cotton swabs leave lint behind and cannot reach the full length of most long lumens. It would be correct if the technician was cleaning the exterior threads of a surgical screw. Option D is incorrect because drying pegs are meant for the external drying of glassware or open basins, not internal lumens. It would be correct if the technician was drying a stainless steel wash basin. Concept extension: instrument air must be used according to the manufacturer instructions for use to prevent pressure damage to delicate internal components of specialized endoscopes. Question 22. While sorting contaminated instruments from a skin abscess drainage procedure, a technician considers the primary pathogen likely coating the tools. Which of these common skin microbes is classified as a gram-positive bacterium? A. Staphylococcus aureus. B. Proteus vulgaris. C. Klebsiella pneumoniae. D. Pseudomonas aeruginosa. Correct answer A. Knowledge point explanation. Core rationale: Staphylococcus aureus is a classic gram-positive bacterium, meaning it retains the crystal violet stain used in the gram staining process, appearing purple under a microscope. It naturally resides on human skin and is a major cause of surgical site infections. Trap analysis: option B is incorrect because Proteus is a gram-negative rod. It would be correct if the technician was dealing with a pathogen commonly associated with urinary tract infections. Option C is incorrect because Klebsiella is a gram-negative encapsulated bacterium. It would be correct if the technician was dealing with a respiratory or ventilator-associated pneumonia pathogen. Option D is incorrect because Pseudomonas is a gram-negative rod. It would be correct if the technician was identifying a pathogen known for forming strong biofilms in moist environments like decontamination sinks. Concept extension: understanding the gram stain characteristics of bacteria helps sterile processing staff appreciate the importance of specific detergents designed to break down bacterial cell walls. Question 23. While assembling a spinal surgery tray, a technician physically tests the biting action of a heavy kerosene rongeur to verify its sharpness. Heavy bone biting instruments such as laminectomy rongeurs should be tested using A. A single sheet of facial tissue paper. B. A rigid plastic dowel rod. C. A specialized rubber testing band. D. A standard paper index card. Correct answer D. Knowledge point explanation. Core rationale: rongeurs are heavy-duty instruments designed to bite through bone. An index card provides the appropriate thickness and resistance to verify that the jaws of a kerosene or laminectomy rongeur can make a clean and sharp cut without tearing the material. Trap analysis: option A is incorrect because tissue paper completely lacks the resistance needed to test a bone rongeur. It would be correct if the technician was testing the sharpness of delicate micro scissors. Option B is incorrect because a plastic dowel rod is too thick and could damage the jaws or not accurately reflect cutting ability. It would be correct if the technician was testing a heavy orthopedic pin cutter. Option C is incorrect because rubber testing material is specifically used for testing surgical scissors. It would be correct if the technician was testing the distal third of a Metzenbaum scissor. Concept extension: when testing a rongeur, it should produce a clean punch through the index card without any snagging, which would indicate the instrument needs professional sharpening. Question 24. While manually cleaning a rigid telescope at the 3-sink station, a technician prepares a final flush to remove all chemical residues from the internal channels. Which fluid must the technician use for this final rinse? A. Highly pressurized facility utility water. B. Tap water mixed with an approved liquid sterilant. C. General treated water from a basic softening system. D. The specific water quality mandated in the manufacturer instructions for use. Correct answer D. Knowledge point explanation. Core rationale. The manufacturer instructions for use represent the primary authority for processing any medical device. They specify the exact water quality required, such as critical water or deionized water, to prevent mineral deposits and ensure the safe removal of all chemical residues. Trap analysis. Option A is incorrect because utility water contains minerals and impurities that cause spotting. It would be correct if the technician was performing the initial gross soil flush in the first sink. Option B is incorrect because sterilants are not used for rinsing detergents and pose a severe chemical hazard. It would be correct if the technician was performing cold chemical sterilization after all cleaning and rinsing were complete. Option C is incorrect because general treated water is vague and might not meet strict critical water standards. It would be correct if discussing the intermediate rinse before the final critical water rinse. Concept extension. Residual detergent left in channels can lead to severe patient tissue irritation or directly interfere with subsequent high-level disinfection or sterilization processes. Question 25. While pulling implants for an upcoming joint replacement surgery, a technician processes a hemiarthroplasty set containing components for only one side of the joint. The medical prefix hemi means A. Near. B. Beside. C. Half. D. Around. Correct answer C. Knowledge point explanation. Core rationale. In medical terminology, hemi is a prefix derived from Greek meaning half. For example, a hemiarthroplasty involves replacing only half of a joint, such as the femoral head in a hip replacement, rather than both the ball and socket. Trap analysis. Option A is incorrect because the prefix for near is juxta or para. It would be correct if defining the prefix para in the word parathyroid. Option B is incorrect because the prefix for beside is also para. It would be correct if the question asked for the prefix meaning alongside or adjacent to. Option D is incorrect because the prefix for around is peri. It would be correct if defining the prefix in perioperative or pericardium. Concept extension. Mastering prefixes like hemi, bi, and multi helps technicians accurately identify the types of surgical sets required for different anatomical interventions. Question 26. While inspecting delicate rasps and chisels at the assembly workstation, a technician prepares a specialized set intended for a septorhinoplasty procedure. The medical term septorhinoplasty means the surgical A. Incision into the nasal cavity. B. Repair and reconstruction of the nasal septum and nose. C. Complete removal of the nasal bone. D. Creation of an artificial opening in the windpipe. Correct answer B. Knowledge point explanation. Core rationale. Septorhinoplasty is a combined surgical procedure. Septo refers to the nasal septum, rhino refers to the nose, and plasty means surgical repair or reconstruction. It is performed to improve both breathing function and appearance. Trap analysis. Option A is incorrect because an incision into a structure uses the suffix otomy. It would be correct if defining the term rhinotomy. Option C is incorrect because the surgical removal of a body part uses the suffix ectomy. It would be correct if defining the term rhinectomy. Option D is incorrect because creating an artificial opening uses the suffix ostomy. It would be correct if defining the term tracheostomy. Concept extension. Procedures ending in plasty typically involve many reconstructive instruments, such as bone rasps, which must be meticulously inspected for trapped debris in the serrations. Question 27. While inspecting a pneumatic power drill system at the assembly table, a technician submerges the air hose in water to check for continuous bubbling. To properly inspect surgical pneumatic hoses, the technician must ensure the hose is A. Manually scrubbed internally using a rigid wire brush. B. Visually inspected using a flexible lighted borescope. C. Processed through an active ultrasonic cleaning cycle. D. Pressurized with compressed gas to detect invisible leaks. Correct answer D. Knowledge point explanation. Core rationale: pneumatic hoses carry high-pressure air to power surgical tools. To ensure there are no microscopic leaks that could indicate a dangerous breach, they must be pressurized while submerged or wiped with a leak detection solution according to the manufacturer instructions. Trap analysis: option A is incorrect because a rigid wire brush will permanently damage the internal lining of the air hose. It would be correct if cleaning the internal channel of a rigid stainless steel suction tube. Option B is incorrect because borescopes cannot detect microscopic air leaks hidden within the layered hose casing. It would be correct if inspecting the internal lumen of an arthroscope sheath for residual soil. Option C is incorrect because manufacturers strictly forbid placing pneumatic hoses in ultrasonic cleaners due to severe seal damage from cavitation. It would be correct if processing solid stainless steel orthopedic drill bits. Concept extension: always ensure the hose is completely dry before sterilization, as moisture trapped inside a pneumatic line can lead to internal corrosion and tool failure during surgery. Question 28. While processing a flexible colonoscope in a manual soaking basin, a technician dips a chemical indicator strip into the orthophthalaldehyde solution. Testing the minimum effective concentration of high-level disinfection solutions is strictly required. A. Once per week before the first scheduled patient case. B. Daily upon opening the sterile processing department. C. Before each and every individual use of the solution. D. Only when visibly diluted by wet instruments. Correct answer C. Knowledge point explanation. Core rationale: the minimum effective concentration is the lowest concentration of the active ingredient that will achieve the required level of disinfection. Because the solution is slightly diluted by wet instruments every time it is used, it must be verified before every single use to ensure absolute patient safety. Trap analysis: option A is incorrect because weekly testing allows diluted and ineffective chemicals to be used on patients for multiple days. It would be correct if performing a routine weekly biological indicator test on a backup steam sterilizer. Option B is incorrect because daily testing ignores the significant fluid dilution that occurs between the first and second scopes processed that day. It would be correct if performing a Bowie-Dick test on a dynamic air removal steam sterilizer. Option D is incorrect because chemical dilution is often visually undetectable and requires chemical verification. It would be correct if determining when to completely discard and change a manual enzymatic soaking bath based on gross soil. Concept extension: always document the minimum effective concentration test results, including the exact time, strip lot number, and pass or fail result, in the high-level disinfection logbook. Question 29. While picking instruments from the sterile storage shelves, a technician loads an arthroscopy set containing specialized shavers onto a surgical case cart. Arthroscopy instruments are specifically designed to be used during A. Brain and spinal cord procedures. B. Abdominal and pelvic cavity procedures. C. Minimally invasive joint surgeries. D. Open chest cardiovascular procedures. Correct answer C. Knowledge point explanation. Core rationale: in medical terminology, arthro means joint and scopy means visual examination. Therefore, arthroscopy instruments are utilized for minimally invasive surgical procedures on a joint, where an examination and treatment of damage are performed. Trap analysis. Option A is incorrect because brain procedures use craniotomy instruments. It would be correct if the technician was pulling a neurosurgery tray with perforators and rongeurs. Option B is incorrect because abdominal cavity procedures use laparoscopy instruments. It would be correct if pulling a laparoscopic cholecystectomy tray for gallbladder removal. Option D is incorrect because open chest procedures use sternal saws and heavy retractors. It would be correct if pulling a coronary artery bypass graft cardiovascular set. Concept extension. Arthroscopy sets often include complex fluid management systems and powered shavers that require meticulous manual cleaning of long, narrow internal lumens. Question 30. While sorting heavy bloody instruments returned from an emergency appendicitis surgery, a technician notes the extreme bioburden associated with this condition. In medical terminology, the suffix itis indicates A. A sudden surgical removal. B. Active tissue inflammation. C. A chronic degenerative disease. D. Severe localized pain. Correct answer B. Knowledge point explanation. Core rationale. In medical terminology, itis is a highly common suffix used to denote inflammation of a specific organ or tissue. Appendicitis, for example, is the severe inflammation of the appendix, which usually leads to surgical intervention. Trap analysis. Option A is incorrect because surgical removal is indicated by the suffix ectomy. It would be correct if defining the suffix in the procedure appendectomy. Option C is incorrect because a chronic disease or abnormal condition is often indicated by the suffix osis. It would be correct if defining the suffix in the diagnosis arthrosis. Option D is incorrect because localized pain is indicated by the suffix algia. It would be correct if defining the suffix in the symptom neuralgia. Concept extension. Recognizing the suffix itis helps technicians understand potential bioburden levels. Instruments used in cases of acute inflammation or infection will carry much higher levels of dangerous infectious material.